Hello everyone, welcome to CONCEPTREE learning. Today we are here to discuss the past chain NEET questions on digestion and absorption in human physiology. This is the sixth part. So moving on to the questions. The first question is, a patient suffering from cholera is given saline drip. Saline drip is saline IV. So they say they give drips, that is what this is. So why do we do that? Because options given are chloride ion are important component of blood plasma. Sodium ions help to retain water in the body. Sodium ions are important in transport of substances across the membrane. Chloride ions help in formation of HCl in the stomach for digestion. So what happens when a patient is affected with cholera? So when the patient is affected, there is suspension of bacterial enterotoxins. So this affects the whole GIT. And what happens is there is a particular biologically important molecule called CAMP. Okay, so this is also increased due to this enterotoxin, and so the membrane permeability of the mucosa of the intestine increases. So what happens? The fluid, instead of getting in, obviously escapes out. So the water is not absorbed much, and so hence from the intestine more water is let out, and that is when it is excreted. So in order to help uptake of water, again we have Na plus ions. Okay, so the option is Na plus ions help retain water in the body. In patients affected with cholera, a cholera enterotoxin is produced, which results in synthesis of cyclic AMP, that is what is called CAMP, adenine monophosphate, which in turn increases the permeability of intestinal mucosa, leading to secretion of fluid through small intestine. Hence the patient is given saline drip where Na plus ions restore the osmotic balance by retaining the water in the body. Which one of the following pairs is mismatched? So the options given are vitamin C scurvy, vitamin D rickets, vitamin K beriberi, vitamin A xerophthalmia. So we know vitamin C scurvy, correct. Vitamin D is rickets in children and osteomalacia in adults. Vitamin A, retinol, causes xerophthalmia or night blindness if it is deficient. Vitamin K does not cause beriberi. Vitamin K deficiency causes hemorrhage, increased hemorrhage. The bleeding time, BT, increases. So vitamin K is a fat soluble vitamin. We know fat soluble vitamins are K, E, D, A. Rest are all water soluble. It is essential for synthesis of prothrombin and other clotting factors. Deficiency of vitamin K increases the clotting time, resulting in prolonged bleeding. Nutrients absorbed by the blood capillaries of intestinal villi go into the options given are liver through hepatic portal vein, hepatic artery, aorta, posterior vena cava. So this is a factual question, but we get confused between hepatic artery and hepatic portal vein. So let's see a picture. We have the liver here, stomach, then we have the intestine. So this is a terminal part of the intestine. So there are venules here. So from capillaries venules are formed, and so these go to the liver before they reach the heart through posterior vena cava. So liver will first go into liver through hepatic portal vein. Hepatic portal system brings venous blood directly from digestive tract, spleen, pancreas, gallbladder to the liver for extraction of nutrients and other metabolites. So liver is the metabolizing factory by hepatic portal vein. The aorta rises from the left ventricle and carries oxygenated blood. So this is the discussion regarding aorta. This is seen in CVS. This is the major artery, one of the largest arteries in the body. Posterior vena cava opens into right atrium, bringing deoxygenated blood from lower half of the body. So from the lower half, deoxygenated blood goes into the heart. One of the factors requiring maturation of erythrocytes is vitamin A. Vitamin A is required for production of rhodopsin, which is visual pigment. Vitamin C is anti-scorbutic. What is anti-scorbutic? Prevents scurvy prevention. Vitamin D is needed in bone metabolism. Okay, so vitamin B12 is required in maturation of RBC. Erythrocytes are also called RBC. Vitamin A takes part in synthesis of retinal pigment. Vitamin C is antioxidant. It also functions as antioxidant. Vitamin D required for absorption of calcium in the intestine. So the calcium is used in bone metabolism. The answer is vitamin B12. Which one of the following is a protein deficiency disease? So the options given are night blindness, eczema, kwashiorkor, cirrhosis. Night blindness is due to vitamin A deficiency. What is eczema? Eczema is a skin disorder. It can be due to various reasons, but not any deficiency. What is cirrhosis? Cirrhosis is inflammation and fatty deposition in liver. This happens in chronic alcoholism. Okay, cirrhosis is in alcoholism, not due to any deficiency. Protein deficiency disorders are only 2 in number as far as our syllabus is concerned. So it's kwashiorkor and marasmus. So here is given kwashiorkor. So the answer is kwashiorkor. Night blindness is caused by deficiency of vitamin A. Cirrhosis is caused by inflammation of liver cells in alcoholism. Which one of the following can be synthesized by bacteria inside the gut? Vitamin B1, vitamin C, vitamin D, and vitamin K. So this is a factual question. So vitamin B1 has to be taken nutritionally, and C also. So D is synthesized on exposure to sunlight, and so vitamin K is produced by symbiotic bacteria in the gut. So the answer is synthesized by bacteria is vitamin K. Vitamin K is a fat soluble vitamin produced in sufficient quantity by intestinal bacteria. Vitamin B1 is water soluble, obtained partially from intestinal bacteria and partially from diet. Vitamin D is fat soluble sterol synthesized in the skin on exposure to skin as a sunlight. Vitamin C is obtained from citrus fruits like lemon and orange. Okay, so the answer is vitamin K. Which one of the following is matching pair of vitamin deficiency disease related with it? So the options given are riboflavin, beriberi, option B thiamine xerophthalmia, option C niacin pellagra, option D calciferol scurvy. So which is matching? They are asking matching. So we know vitamin D calciferol, it causes it does not cause any scurvy, it causes osteomalacia. Thiamine xerophthalmia is due to vitamin A. So this is also wrong. So this is wrong, this is wrong. Riboflavin, beriberi is due to B1 deficiency, not riboflavin. So the answer is niacin pellagra. Niacin deficiency causes pellagra. Beriberi is a deficiency disease caused by vitamin B1 deficiency. The deficiency of riboflavin causes albinoflavinosis. Okay, riboflavinosis. Scurvy is the result of lack of vitamin C in the disease. So scurvy is due to vitamin C deficiency. Deficiency of calciferol in the diet causes rickets in children and osteomalacia in adults. So the answer is niacin. The vitamin C or ascorbic acid prevents. As we saw, it's scurvy only. Scurvy is disease with bleeding gums and thinning bones. Bleeding gums is also called gingivitis. So they can also ask which causes thinning bones and gingivitis. So we have to say vitamin C. It is caused because of deficiency of C. It can be cured by taking citrus fruits. A dental disease characterized by mottling of teeth is due to presence of certain chemical elements in the drinking water. Which of the following is that? Mercury, chlorine, fluorine, and boron. So the answer is fluorine. Mercury is generally seen in poisoning but not related with tooth. It's only used in tooth restoration and amalgam, but not any disease related. Chlorine is not related much to tooth. Boron is also not related to. Fluorine only causes fluorosis when in excess quantity. That causes mottling of the tooth. The excess of fluorine in water causes a condition called fluorosis, which is identified by mottling of tooth, yellowish streaks on the tooth, and abnormal bones liable to fracture. So moving on to the next question. Prolonged deficiency of nicotinic acid produces. So this is a fact we know pellagra. Osteomalacia is due to vitamin D deficiency. Xerophthalmia is due to vitamin A deficiency. And anemia is due to vitamin B12. Okay. Calcium deficiency occurs in the absence of vitamin. So we know vitamin D itself is called calciferol. So if it's not present, calcium absorption is reduced. So vitamin E, when it is deficient, it causes sterility. Vitamin C, when it is reduced, it causes scurvy. Vitamin B complex, variety of diseases, beriberi, etc. So vitamin D, ergocalciferol or anti-rachitic vitamin, which is commonly known as sunshine hormone, sunshine vitamin. So like when we are exposed to sunshine, this hormone is produced beneath our skin. So that's why we need to expose ourselves to sunlight frequently. Regulates absorption of calcium and phosphorus from gastrointestinal tract and helps in normal growth of bone and teeth. In deficiency, disturbs the calcium and phosphorus absorption, and hence deficiency of these minerals in body causes soft bones. When bones become curved and fragile, that's osteomalacia and teeth decay. Vitamin K is required for. Options given are change of prothrombin to thrombin. Option B, synthesis of prothrombin. Option C, change of fibrinogen to fibrin. Option D, formation of thromboplastin. So this is a fact. So it helps in synthesis of prothrombin. That is why it is called anti-hemorrhagic factor. Anti-hemorrhagic factor. This vitamin is essential for synthesis of prothrombin in the liver cells. Since prothrombin is also a protein, it is produced in liver, which is essential for normal blood clotting. It is also synthesized by bacteria present in the colon in abundant quantities. Which of the following pair is characterized by swollen lips, thickened pigment of skin, hands and legs, and irritability? So this is seen in nicotinamide pellagra. Thiamine deficiency causes beriberi. This is a known fact. Protein deficiency causes kwashiorkor. Iodine deficiency causes goiter due to hypothyroidism. Nicotinamide causes pellagra. Pellagra is characterized by skin inflammation, especially thick pigmented skin in hands and legs, swollen lips, diarrhea, nervous disorder caused by deficiency of B3 is also known as nicotinic acid or vitamin PP, pellagra preventing factor. So vitamin B3. Answer is no. Thank you. gas staying factor. Hello everyone. Causes the release of sodium. So digestion.
Hello everyone.
Hello everyone. Today we are here to discuss the previous year NEET questions on digestion and absorption in human physiology. This is the part 6. So going on to the video. So the first question is: a patient suffering from cholera is given saline drip because chloride ions are important component of blood plasma. Sodium ions help in retention of water in the body. Sodium ions are important in transport of substances across the membrane. Chloride ions help in formation of HCl in the stomach for digestion. So let's see what happens when a person is affected with cholera. So in cholera, the bacteria produces an enterotoxin. Okay, so the enterotoxin, when it increases in the body, there is increased production of CAMP, cyclic adenine monophosphate. So when this happens, the permeability of the mucosa of the intestine increases. So instead of water getting absorbed, the fluid tends to move out. So when the fluid moves out, there is dehydration, constant dehydration. So to tackle this, what we do, we supplement with IV Na+. So what happens? The Na+ helps in transportation of water across the membrane into the body instead of out of the body. So this helps in tackling with the dehydration. So Na+ ion helps to retain water in the body. In patients affected with cholera, a cholera enterotoxin is produced, which results in increased synthesis of intracellular CAMP, cyclic AMP, which in turn increases the permeability of intestinal mucosa, as we said, leading to secretion of fluid throughout the small intestine. Hence, the patient is given saline drip, where Na+ ions restore the osmotic balance by retaining water in the body. So moving on to the next question. Which one of the following pairs is mismatched? Options given are vitamin C scurvy, vitamin D rickets, vitamin K beriberi, or vitamin A xerophthalmia. So we know vitamin A K deficiency causes hemorrhage, not beriberi. Beriberi is due to deficiency of vitamin B3, not vitamin K. So it's fat soluble vitamin. It is essential for synthesis of prothrombin. Very important, synthesis of prothrombin and other clotting factors. Deficiency of vitamin K increases clotting time, resulting in prolonged bleeding. So moving on to the next question. Nutrition absorbed by blood capillaries of intestinal villi first goes into option A, liver through hepatic portal vein, option B, hepatic artery, option C, aorta, option B, posterior vena cava. So aorta is a artery that supplies the largest artery arising from the heart that supplies the whole body. Posterior vena cava reaches the right atrium and collects all the bad blood or deoxygenated blood and gives it to the heart. Hepatic artery supplies the liver, but it does not collect any nutrients from the intestine. So what happens is, from the intestine, let's look at a picture. From the intestine, the venules all combine together and enter the liver. So throughout from the GIT, the nutrients are all taken to the liver for the processing, and then they reach the heart. So it is first liver through hepatic portal vein. Hepatic portal system brings venous blood directly from digestive tract, spleen, pancreas and gallbladder to the liver for extraction of nutrients and other metabolites by hepatic portal vein. Aorta rises from left ventricle and carries oxygenated blood. Posterior vena cava opens into the right atrium, bringing deoxygenated blood from lower half of the body.